All right, guys. Everybody always gets up in arms and makes assumptions and kind of gets into this argument over the discussion of diabetes, type 2 diabetes being reversible and being preventable, and the difference between type 1 and type 2. And when I say that diabetes is reversible and preventable, many people construe that what I'm saying is all diabetes, or that type 1 diabetes is preventable. Obviously, type 1 diabetes is not preventable, but it is manageable. And a couple things to consider when you talk about what is going on with diabetes in the world today, and how prevalent it is in the population, and how it's grown, right? It used to be, you talk about diabetes, you're talking about people that were old, right? In their 60s, 70s, and 80s, talking about diabetes. And now we're talking about kids that are 10, 11, 12 having diabetes. It's ridiculous, okay? And for anybody to use the argument that diabetes is not reversible, and that they're going to base what they think about diabetes on the current methodologies in place, on the current diet recommendations in place, on the current science, big air quotes here, not even current science, but I'm going to say established science, not current science, because established science is not current. For anybody to use any of those factors in their argument against type 2 diabetes being reversible and preventable, it tells me right off the bat that they don't know what they're talking about. You're talking to somebody who has worked with people with diabetes, reversed it. You're talking to someone who knows hundreds and has contact with doctors all over the world, who has hundreds and thousands of people who with type 2 diabetes who have reversed it. We know for a fact it is a lifestyle disease. Metabolic syndrome is something that is caused by having an unhealthy lifestyle. Okay? If one person can reverse their diabetes, type 2 diabetes, then it is by definition a reversible disease. If one person can do it, 2 people can do it, 3 people can do it, and more, right? It's like a Dr. Seuss book, okay? You cannot convince me, because I have seen it with these things, that it's possible. I don't care what scientific review you throw at me, what peer-reviewed article, what scientific study, what the science you've been taught since you were in medical school 30 years ago, whatever it is, okay? I have seen it with my own eyes, therefore I know it to be true. That's all that I need to know. You cannot convince me otherwise. Type 2 diabetes is reversible. It can happen, okay? Lifestyle changes will do it, okay? Losing weight, increasing muscle mass, fixing insulin resistance, right? Improving metabolic health, okay? All of these things are things that are lifestyle factors that can be improved by fixing your nutrition and fixing your fitness, right? Getting your body moving, get some activity, move some weight, learn how to move your body and do some work, okay? Done. That's it. On the type 1 diabetes side, it is possible 100% to reduce the amount of insulin that a type 1 diabetic needs on a day-to-day basis. How do I know this? Not because of a study, not because of some article that was written somewhere, okay? Because I have worked with people who have done it. I have seen firsthand that it is possible. You cannot convince me that the sky is red, because when I look at the sky, it is blue, okay? When I look at type 1 diabetics that I have personally worked with, and they have reduced their insulin by 50% or more consistently, sustainably, you cannot tell me that it's not possible. Not happening. It is manageable. It is definitely possible to reduce a person's cost, right? The cost for their medication, their insulin, and the amount that they need to take, right? It is possible to level out their glucose throughout the day. It is possible to do so many things for these two types of the same disease, okay? It boggles my mind that someone's going to use what they were taught instead of what people are seeing every single day with the improvement in type 1 and type 2 diabetes and the lifestyle of the people that have it and the health of the people that have it and the reversal of people that have type 2 and the management of their lifestyle for people that have type 1. Okay? Argue all you want, but when you see it with your eyes, there's really not much to argue about.